Yeah, my name is Dr. John Feller. I'm the Chief Medical Officer for Halo Precision Diagnostics, based in Indian Wells, California. Multiparametric MRI of the prostate is a relatively new way of taking special pictures of your prostate gland. It's kind of like the first time you went to see the Statue of Liberty. When you go around her, you can take black and white pictures, or you can take color pictures, or you can take video of her while you're going around her, which are all kind of different ways to look at the Statue of Liberty. And we do the same thing with MRI to take pictures of your prostate gland a whole bunch of different ways so that cancer can't be sneaky and have us miss it because we only took pictures of it one particular way. So by taking a bunch of different kinds of pictures, it maximizes our ability to find your prostate cancer. A prostate MRI is necessary most commonly in the setting of a person who has an elevated prostate-specific antigen. That's the screening test for prostate cancer, which actually reduces the mortality of prostate cancer by up to 50%. But that number can be elevated for a number of different reasons. It could be inflammation in your prostate, it could be benign enlargement of the prostate, or it could be due to prostate cancer. There's no way to tell that difference without doing the multiparametric MRI of the prostate. So the main reason to do it is to help with early detection of prostate cancer and explain why your screening serum PSA test may be elevated. So the preparation for an MRI of your prostate is pretty simple. We ask you to not eat foods that are kind of gassy for you, like bean burritos, the night before, probably not such a good idea. We also ask you to abstain from ejaculation for 3 days. And the reason for that is we want to get a very good look at the part of your prostate anatomy called the seminal vesicles. And when they're still filled with fluid, we can see them very well. So abstaining from ejaculation for 3 days, watching what you eat, and then the morning of the procedure, in many facilities, they'll have you do an enema that they provide and have you go to the bathroom and use that immediately before doing your prostate MRI. The final thing we usually do is have you empty your bladder so that your urinary bladder is not full during the test. The procedure of multiparametric MRI is pretty similar to having any other type of an MRI, so it's not painful. There is the placement of an intravenous catheter or an IV, and that's so we can give you some dye or contrast that helps us to get a better look at your prostate gland. So that's like getting your blood drawn. So the technologist, the person taking the pictures, or a nurse will put an IV in your arm, and then you just need to lay flat inside the MRI scanner while we take pictures. Prostate MRI, usually on the table, is less than 45 minutes, but the entire visit may take about an hour because there's some intake paperwork and getting your intravenous catheter put in place and then doing the enema right before you get the examination done. There's a contrast agent involved with doing this multiparametric MRI of your prostate. It's called a gadolinium-based contrast. That's just a fancy name for a kind of a dye that we give through your IV, your intravenous catheter, and it helps us to take better pictures of your prostate gland, especially areas where the blood supply is increased because of a prostate cancer that may be growing there. MRI of your prostate is very good at finding whether or not you have prostate cancer, but it's not perfect. It finds between 85% and 90% of clinically significant prostate cancers. About 10% to 15% we can't see with the MRI. But there's some growing evidence that the ones that we can't see with MRI are actually less likely to be clinically significant to you. So the PIRADS score, or PIRADS score, is a scoring system that the radiologist, the physician who is interpreting your MRI examination, uses to assign areas that look suspicious, just exactly how suspicious they are. So it's like golf. The lower the number, the better. PIRADS goes from 1 to 5, 1 being virtually no chance that the finding on the MRI is a prostate cancer, to a 5 where there's a very high likelihood that it represents a clinically significant prostate cancer. For patients who are claustrophobic, which by the way is incredibly common, so don't beat yourself up about it kind of a thing, about 15% of patients who show up for an MRI actually have significant claustrophobia. And to handle that, we're prepared to give some sedation, some conscious sedation, usually just by mouth, that helps you to relax during the procedure. If you do know that you're claustrophobic and may need some sedation, it's important that you bring a driver along with you because you'll need somebody to drive you home afterwards. An open MRI machine is a type of an MRI machine that architecture-wise is more open so that the patient can look out from inside the MRI scanner while their pictures are being taken. That's compared with a cylindrical MRI system that looks more like a donut or a closed MRI system. Now it turns out for a prostate MRI, there really aren't any open MRI scanners that meet the minimum criteria of field strength that we need to be able to do the prostate MRI. The PIRADS criteria calls for a 1.5 Tesla or a 3 Tesla MRI to perform your prostate MRI. So that's typically going to be a cylindrical or a donut or a closed type of an MRI and not an open MRI. So MRI helps with not only detecting your prostate cancer and locating it, but it also helps with stage. Stage is just exactly where the cancer has spread. So has it spread outside the prostate? That's called extraprostatic extension. Has it invaded the seminal vesicle? Has it invaded the neurovascular bundle? Has it spread to lymph nodes around the prostate gland? Or has it spread to your bones? Those things we can see within the pelvis with the prostate MRI. So it is very helpful not only for detecting the prostate cancer, but also for staging it.